are trained and deployed with a focus on aligning education to real needs of Uganda's healthcare system. Speaking at the event, Minister Acheng highlighted that the challenges facing the sector go beyond staffing shortages. She pointed out to outdated training curricula, inconsistent standards, limited specialized trainers, and also weak internship systems as key gaps affecting service delivery among healthcare. She emphasized the need for health institutes to prioritize patients over profit if quality healthcare is to be achieved. The policy introduces wide-ranging reforms, including the integration of artificial intelligence in medical training, improved regulation of training materials, and stronger oversight of traditional and complementary medicine. According to Safina Masene from the Ministry of Education, the initiative is designed to bridge the gap between the theory and also practice, ensuring that graduates are equipped with practical and also the life-saving skills. Uganda continues to face a significant shortage of the health workers, and the World Health Organization recommends at least 4.45 skilled health workers per 1,000 people, but Uganda remains far below that threshold, with doctor-to-patient ratios estimated about 1 to 25,000. Officials say that this new policy will help build a more competent and also a responsive health workforce, ultimately improving service delivery across the country. Now, moving on to our next story. Ntungamo has faced a rising HIV, stroke, AIDS, and TB burden as rights body probes barriers to care. Health officials in Ntungamo district are raising an alarm over a growing public crisis as both HIV and tuberculosis cases continue to rise above the national levels. According to the district data, HIV prevalence has reached 6%, higher than Uganda's national average of 5.1%, with more than 300 new infections recorded every quarter. Out of an estimated 21,000 people living with HIV in the district, about 18,000 are currently receiving treatment, leaving the nearly 3,000 individuals either undiagnosed or not yet linked to care. Health experts say that the rising numbers are being driven by high-risk behaviors, misinformation, and also persistent stigma within the communities. Officials have also flagged dangerous misconceptions, including the use of polythene bags as a protection against HIV and other infections, practices that highlight serious gaps in the public awareness of the area. At the same time, tuberculosis still remains an issue, with between 203 and 230 new infections reported every after 3 months. Experts warn that TB spreads easily through the air, especially in crowded settings and among people living with HIV. Despite treatment coverage exceeding 90% in the area, ongoing transmission with households and densely populated communities continue to pose a major challenge. The Equal Opportunities Commission has now launched an investigation into barriers preventing people from accessing healthcare, particularly those linked to stigma, discrimination, and also possible human rights violations. Officials say access to HIV, TB, and malaria treatment is right and should be free in all the public health facilities. Findings from the probe are expected to guide targeted interventions aimed at improving the service delivery, strengthening community support system, and also ensuring that the vulnerable populations can access life-saving care without the discrimination. Now, that has been the news from that area. Moving on to our next story, Museveni signs a landmark policy establishing a national drug authority. President Yoweri Museveni has signed into a law of the landmark bill establishing the National Drug and Health Products Authority in a major step towards strengthening regulation of medicines and also health practices in Uganda. The new law replaces of an outdated 1993 framework and expands oversight to cover a wide range of products, including the vaccines, medical discoveries, medical devices, diagnostics, cosmetics, and also nutritional supplements. Officials say that this reform is aimed to tackling the counterfeit drugs, improving safety standards, and also tightening control across the entire pharmaceutical supply chain, from manufacturing to the distribution and use. Under the law, operating without a license now carries tough penalties, including up to 10 years in prison or fines of up to 200 million shillings. The legislation also introduces strict rules on drug advertising, requiring all promotions to be approved and limiting them to verified medical uses. Violations could attract fines of up to 400 million shillings or jail terms of up to 15 years in prison. Health Minister Jane Ruth Acheng says the law will also allow controlled access to unregistered medicines in special cases such as emergencies, clinical trials, and also compassionate care for critically ill patients. In addition, all pharmacies will now be required to operate under a licensed pharmacist with penalties for illegal operations. The law further introduces new systems to track medicines and also prevent counterfeits, including mandatory certification for vaccines and other biological products before they enter the market. For the first time, cosmetic products will now fall under strict regulatory control with heavy penalties for unlicensed production or the distribution. Authorities say that this new framework will modernize Uganda's drug regulation system, close existing loopholes, and also better protect the public health at large. Now, that's about the new policy that has been passed by our President, General Yoweri Kaguta Museveni. Now, moving on still to our national story. Experts have sounded an alarm over rise in psychopathy and also sociopath. Mental health experts in Uganda are now raising concern over a high growing but often overlooked condition, antisocial personality disorder, commonly associated with psychopath and also sociopath. With public health attention has largely focused on anxiety and depressions, and also specialists warn that more severe behavioral disorders are quietly increasing, often going unnoticed until serious harm is done to the families and communities. According to the State of Uganda Population Report 2026, nearly 1 of 4 Ugandans is affected by a mental health condition. However, fewer than 1 in 10 people receive the care they need. Experts explain that psychopath is marked by a lack of empathy, remorse, and also cautious, often combined with manipulative and also antisocial behavior. Psychopath, on the other hand, involves persistent disregard for the social norms, laws, and the rights of others. Clinical psychopathologist Vivian Olgan Kuda says many cases go undetected because early warning signs are often ignored or misunderstood. She notes that families usually seek help only when the situation of their personnel has escalated, highlighting the urgent need for community awareness and also the early intervention. Mental health cases in Uganda have actually highly sharpened by more than 70% between the year 2021 and the year 2024, underscoring that experts describe as a silent but a glowing crisis. Specialists are now calling for increased public education, early diagnosis, and improved access to mental health services to prevent the long-term social and also psychological harm. Now, moving on to our global story. Pandemic treaty talks enter the final stretch as equity concerns grow. Now, global negotiations have been ongoing on a pandemic treaty are entering their final stretch in Geneva, with growing concerns from the civil society groups over the fairness in access to life-saving tools during the future health crisis. The talks led by the World Health Organizations are expected to conclude ahead of the upcoming World Health Assembly, where the agreement will be presented at the heart, where these agreements will be presented. And at the heart of the discussions is the pathogen access and the benefit sharing mechanism known as PABS, with which will determine how countries share pathogen samples and also the genetic data and how the benefits such as vaccines, diagnostics, and treatments are distributed. Health advocates warn that failure to secure a strong and binding agreement could repeat the inequalities seen during the COVID-19 pandemic, where wealthier nations accessed vaccines first while developing countries were left behind. Experts say that one of the biggest concerns is that countries contributing biological samples are still not guaranteed for fair access to the final medical products. There are also calls for stronger commitments on the technology transfer to enable countries, especially in Africa, to produce vaccines locally rather than relying on the exports they receive. Financing remains another key, with uncertainty over how a global pandemic response fund will be sustained without overburdening low-income nations. Advocates stress that this is a critical moment for global health equity, warning that without clear commitments now, future pandemics could again disproportionately affect the vulnerable countries. They are also urging governments, including Uganda's Ministry of Health, to push a fair and balanced agreement that ensures equal to life-saving interventions. Now, those were our health updates for today, but today in Discovery, we are going to look at one of the biggest hospitals in India that handles the cardiovascular system. Let's take a look at it, and then we come back with more.
Lifestyle changes have led to an unprecedented jump in non-communicable cardiovascular diseases. In the wake of this situation, Healing Hospital, an NABH accredited facility, has developed an advanced institute of comprehensive heart and vascular care to improve heart's health and a healthy lifestyle. Our cardiac sciences department is helmed by the leading cardiologists and cardiac surgeons, offering a multitude of treatments and procedures in cardiology and cardiothoracic surgery.
मेरी छाती च दर्द होया सी, फिर मेरे इत्थे आण के इन्हां ने स्टेंट पाता, ਉਹ ਮੇਰਾ ਬਹੁਤ ਵਧੀਆ ਰਿਹਾ। ਹੁਣ 3 ਮਹੀਨੇ ਹੋ ਗਿਆ ਮੇਰੀ ਦਵਾਈ ਚੱਲ ਰਹੀ ਆ, ਮੈਂ ਬਿਲਕੁਲ ਠੀਕ ਠਾਕ ਆ। ਪੌੜੀਆਂ ਵੀ ਚੜ੍ਹ ਲੈਂਦੀ ਆ, ਘਰ ਦਾ ਕੰਮ ਵੀ ਕਰ ਲੈਂਦੀ ਆ, ਸਾਰੇ ਕੰਮ ਹੁਣ ਆਪ ਕਰਦੀ ਆ।
We have set up this boutique kind of cardiovascular sciences department recently for the citizens of, for the people of Chandigarh and Tri-City. We are doing all kind of adult and pediatric kind of work here. which involves valve replacement, adult bypass surgeries, and the repair of the by-birth defects, which we call them congenital defects.
Our third generation cath lab, cardiac critical care unit and intensive care unit support our experienced cardiologists and cardiac surgeons, making us the most sought after cardiac sciences hospital in Tri-City.
At Healing Hospitals, in the cardiology department, we are treating all types of patients who are requiring maybe the medical management or interventional management, and subsequently if they even require surgical management. We do implant ICDs also over here. Few patients who require high-end therapies like CRT-D or CRT-P, that is also being done over here. Right, starting from the femoral sheaths or radial sheaths, guiding catheters, guiding wires, or stents, pacemakers, they are all FDA approved.
इतनी अच्छी ट्रीटमेंट मिली और ड्यूरिंग सर्जरी भी हॉस्पिटलाइजेशन ਦੇ ਵਿੱਚ ਨਰਸਿਸ की स्टाफ के they are excellent. मेरा एक्सपीरियंस इस हॉस्पिटल का बहुत अच्छा है and I appreciate doctors also.
The concept is that we are treating life, we are not treating patients. When the focus is on the life, then the other focuses go away, and it becomes very win-win situation for the patient as well as for the physician, and it's very, very satisfying for both sides.
In addition to heart care, Healing Hospital provides cutting-edge healthcare services across various departments with the help of an experienced and trained team of super specialist doctors.
ਸਾਨੂੰ ਜਲਣ ਦੀ ਤਕਲੀਫ ਦੀ ਪਹਿਲਾਂ ਜਲਣ ਹੋਣੀ ਸ਼ੁਰੂ ਹੋਈ ਹੈ। ਡਾਕਟਰ ਸਰਵਾਲ ਦਾ ਪਤਾ ਲੱਗਿਆ, ਡਾਕਟਰ ਸਰਵਾਲ ਕੋਲ ਗਏ। 1.5 ਸਾਲ ਤੋਂ ਦਵਾਈ ਖਾ ਰਹੇ ਸੀ ਅਸੀਂ। ਹੀਲਿੰਗ ਹਸਪਤਾਲ ਦੇ ਵਿੱਚ ਸਰਜਰੀ ਬਹੁਤ ਵਧੀਆ ਹੋਈ ਹੈ, ਸਟਾਫ ਬਹੁਤ ਵਧੀਆ ਹੈ।
Insight. And today we are diving into a topic that has gained a massive attention across all the people, and this is detox and herbal cleansing solutions. From the detox teas we know to the herbal cleansers, and also many people are turning to these methods to clean their bodies, lose weight, and also improve their overall health. But the big question is, do these methods really work? And are we being misled? So is our body designed to detox itself, or we have to do these herbal cleansing solutions? And where do they actually come in? To help us understand better, we have been joined by our expert, and this is none other than Dr. Kunobwa Godfrey, who is going to help us understand the approach of the detox cleansing solution. How do they work? Do they really work, or it's just something that is just there out in the market? So you're most welcome, Doctor, once again.
Thank you very much.
And thank you for accepting to come again here.
That's good. I also appreciate.
Okay.
Yeah, because you know the nature of my work. I'm a medical missionary.
Yes, sure.
So it is really in our mind to at least help the nation.
Okay.
Yeah.
We appreciate the time you give to talk to the nation and also teach them about situations about their health.
Yes.
Yes. Thank you
That's
for
great.
coming.
Thank you.
Yeah. So, Doctor, before we head any further, we've seen a video in Discovery there in our segment for Discovery.
Yes.
What's your take on it, on those hospitals in India?
You know, these days it's a trend of the period of time, because mostly you can see that most of our people actually they are taken into those hospitals.
Yeah.
But we also need to appreciate ours. You know, the problem that we face here, it's actually, it is becoming psychological, because you may find that most of the things that are done out there, it can as well be done here.
Because of recent, we actually reported a news here for the first ever bone marrow transplant that happened within the country. In those days, people used to travel to India to get the transplant.
Yes.
And now it was the first one, meaning we can do those things.
Yeah, things can be done here. And you know, what amazes is that most of the time people actually are taken abroad. But you know, what's so funny is that as they go there, they may find doctors from Uganda also being the ones that are operating in those ends. So let's love ours. Let's love our nation. Let's love our people. Let's have actually confidence in them.
Yeah, sure. Because that's the first step for us as a country to develop.
That's it.
So thank you very much, Doctor, for that insight. So today we are talking about detox and herbal cleansing solutions. So to start off, what exactly these cleansing solutions, and what is detox in your terms?
Thank you very much for that question. But we also need to understand this. You know, in creation, when God created man, actually, he did put everything. You know, in the mechanism of humans, the Lord had put everything that would help and assist the body in doing repair, in detoxifying itself. That's why we're having most of the organs that we're having, which are actually directed to that, is the excretory system. We have also the largest organ, which is the skin. Yes. You know, we have the kidneys.
Yes.
We have even the digestive system also. They do detox
themselves.
Yeah. Okay. So the more you see, when people are sweating, they are detoxifying their bodies.
Yes.
When we go outside there in toilet, we are also detoxifying
our bodies.
When we go out for a susu, that's also detoxifying. Sure. After the system has actually seen that this is a waste, it has to get out. Yeah.
So detoxifying is the system taking out what
is bad. Yes.
Not good for our bodies. Okay.
Yes.
So why are these detoxing and the solutions becoming so popular today? Because lots of the people are using them right now. Why do you
Yeah,
think they're
it is so because the problem we are facing today is that we don't use our bodies to function properly.
Yeah.
That's why we need to get foreign substances to help or to aid the system. Because actually you can see that most of the time you may develop diarrhea. You begin to diurate, and when you're diureting, that's why we do give advice that if someone is diureting, please don't stop the diarrhea.
Okay.
Until it becomes severe. You get it?
Yeah, sure.
Because the body itself knows.
Okay, knows what to do.
Yes, it can detox instead. But today, because people actually in it, the bodies are not functioning in the proper way.
Yes.
So that's why we need to go out there and get detoxifiers from outside. And detoxifiers do a very great job. Just because, you know, at least it helps. It helps from the bad situation to at least to cleaning or to healing.
Okay.
Yeah.
So they are highly used because they help in excreting out.
Yeah,
of
that's it.
Okay, so doctor, what are some of the common types of detoxing methods people are using today?
There are many. You may see that some others they use enema.
When okay, enema. Oh my God. It's
And enema also. There are many types of enemas. The conventional, they have bottles which they open and then put it inside, and then it cleanses the colony from
down.
Yeah, from down. You know. Then there is others which are taken. They just drink it.
Okay.
Then it also begins from here, and they come to the guts, the system, the entire system, and it gets out. Others they use some substances that can help, like detoxifying the liver and also the kidneys.
Okay.
Yeah, so there are many ways actually that people use. It depends on how you understand it and how you can handle it.
Okay.
Yeah.
So doctor, who actually needs to detox?
Basically, when you view at the people, you may see sometimes if you see that, number one, you don't go to toilet well when you're constipated.
Yes.
The more you stay with these things inside, you know there is something that we need also to think about, and that is what is called toxins.
Yeah. Yes.
You know there is no way you can detox when there are no toxins in the body.
So we need to understand what toxins are.
Yes. And these are the poisons that are created inside ourselves.
Okay.
Some of them we just inject them actually like when we are taking things that we're eating. So we put inside these problems. And when they get inside, they need to get out. So the only way you can do it is to detox. By taking these substances or herbal or doing the enemas. But even enemas, they have some styles of doing it.
Yeah.
So when you see that you don't go to toilet, then that means that you need to detox. Because the more you stay with this thing, some of us, some of the people that actually are constipated, or they take some days without going to toilet.
To toilet, of course.
Yeah. If you don't defecate in the right way, then the best thing is to do detox. Because the more you leave this food stay there, it becomes toxic
to the body.
Yeah, it becomes poison.
Okay.
Yeah, the more it stays there. That's why you see that most of the people, as you look at them, they're like cesspools,
Yes.
Yeah. So that's why they need to cleanse. Yeah. The more you stay with it, the more it creates a lot of poisons, and these poisons will actually cause a lot of other effects. Yeah. From there, you can go to people can suffer from diabetes, can suffer from heart problems. Yeah, just because of that.
Okay, so doctor, on that same note, what are the other things that can lead a person to detox?
As we say that if your liver is overwhelmed with the poisons that you ingest in, then it needs to be detoxified.
Okay.
And most of the time, the liver, this is the organ that is actually is made in creation that for it is just there waiting for all poisons that are entering into the body.
Okay.
Through what we eat. Most of the things that we eat, most of these things that we think that are simple, simple to find, simple to use,
Yes.
they are laden with a lot of chemicals in the disguise of preventive or preservatives.
Yes.
Yeah?
Yes.
Most of the foods that we use that are having a lot of preservatives, basically, they are dangerous to our system. That's why you see that the liver, it's waiting, it's there waiting
Okay.
for all these poisons to come in. Sometimes it becomes overwhelmed and it needs to be aided,
Okay.
to be helped so that actually you relieve it also.
Okay.
That's why you need the detoxification.
Okay.
Same applies to the kidneys as well. Yeah.
Okay. Okay, so we have seen the detox.
Yeah.
How about what the herbal cleansing solutions, and how do they actually work?
Now these ones, they depend. It depends because in creation we have a lot of plants actually that are being used for detoxifying.
Okay.
Yeah, they do the cleansing. They do colony cleansing.
Yes.
They also aid the liver and also aid the kidneys.
Okay.
Yeah, we know how we can get herbs that can as well cleanse the kidneys. Yeah, even get rid of kidney stones and whatever
Okay.
by using herbs.
Are there any specific herbs that are commonly used?
Yeah, commonly used. We may think even of there is one that is called Senna.
Sena, what's that in Uganda? Okay, I know one. I know one that is called Chisanda. Most people use that.
Yes, but this one is called Omchura.
Omchura. Okay.
Yes, but also there are some plants. There are also some plants. Capsicum, the red, the yellow, the green.
Okay.
These ones are also very good detoxifiers. Yeah, including other things like broccoli. Talk
okay.
about tomatoes, cucumber, garlic and onion.
Okay.
And garlic so much because garlic is one of the best antibiotics in the world, so it helps a lot of things.
Okay.
Yeah.
Okay, so how long should proper herbal cleanse last?
Actually, basically we normally do it 3 days is enough.
Okay.
Yeah, 3 days is enough.
So you take it today, tomorrow, and the following day is enough.
That's it.
How often, should a person do use the herbal cleansing solutions to detox?
Yeah, detoxifying basically people need to learn about this also. Detoxifying basically is normally used 6 months. Yeah.
Every after 6 months, that's when you should use the detox. Okay.
That's the best. Yeah, because you know there's certain cells and we know that cells build in between 100 and 200 days. Yeah.
Okay, so doctor, we've seen the herbs. You've given us the herbs. Are there also foods that people take that are used as the herbal cleansing?
Foods
instead of the products? Yes.
Yeah, as I've said that because when you eat food that are having a lot of fiber,
Yes.
fiber becomes as a sponge
Okay.
to clean the colony. And most of the time, why we get constipated is because we use refined foods.
Okay.
The foods that are not having any fiber in
Yes,
it.
yes.
That's that food tends to stay longer in the colony.
Okay.
But when you eat food with fiber, when I talk about fiber, I talk about a cleanser.
Okay.
Yeah, that's why you see that we normally advise people that when you're eating refined foods, it would be better for you to use a lot of vegetables.
Okay.
You can use cooked ones or you can use the raw ones as salads.
Okay.
Yeah, whenever you are preparing foods and you know that this food is very much refined, the best thing is that you should be having at least a simple plate
Okay.
for salads,
Yes.
so that it can help.
Okay.
That's why you see the Kenyans, they call it skuma witch.
Okay.
Is
Yes.
to push so that the colony can be cleansed.
Okay.
And don't retain that food there for many days, such that it can create poisons into the system.
Okay, so doctor, you've talked about the herbs, but sometimes we see that the herbs also come with their issues. Like, let me say the example I gave you, the one called Chisanda. We've seen that when sometimes if they take that, the person who takes that herb can become like dehydrated, the issues that come with the detoxing solutions.
Yeah, basically it is so, just because the way people are using it, they are not informed.
Okay.
You know, we have hearsays. You had someone used it and the other one used it. And you know, our bodies are different.
Yes.
I may be strong and may be weak.
Okay.
I may be having, or my body may be containing enough water. You know, sometimes when people come to us, we do even take the water content in the body.
Okay. Yes.
Yeah, we can check and tell you, you have less water. Please, go and add on the water that you take.
Okay.
Huh?
Yes.
So some people are dehydrated already. And people who don't take water, they are dehydrated. So when he goes and diuretes
That's another issue.
profusely, then that's another issue. He will be diureting, hydrating himself.
Okay. But doctor, are these detox and also the herbal cleansing solutions, are they necessary? Are they even necessary, or they are just overrated? Like,
No, they are necessary because it's the process. When you detox, it helps you to go to healing.
okay.
And basically, most of the people that are actually going to use natural remedies, detox is part of it.
Okay.
First you remove, then you begin to treat.
Okay.
Because otherwise it may be washing and drying on the ground. Yeah.
So, doctor, some experts say that the liver and also kidneys, like they already detoxified like the body. So, are these some of the detox products just a trend, a business trend, something people are using, because there are many on the market?
Yeah, that's why we need to be so also curious on what we need, because some of us just marketeers.
Okay.
Marketeers of products. Okay.
Yes.
So if someone is just a marketeer of a product, he can push it into your mind and you just buy.
Okay.
But we need also to be careful, because most of the time you need to actually go into the depths of knowing the product itself,
Okay.
and how it is going to help you. Most of them don't even help anyway.
Yeah, sure. Okay. So, doctor, many of these detoxing solutions we've seen on market, like they promise weight loss. Are these methods a real fat loss, or it's just like loss of water?
You know, someone is playing on your brains.
Okay.
Because when you give someone weight loss substance, and you will find that it is always it helps always to diurete, and if not so, it will help in sweating.
No, okay, not removing the fat as
You may lose some fat through sweating. You can lose, and also through urination you can lose the fat.
Okay.
But most of the time, you can get a substance that can just bring a heat inside in the body,
In the body.
and then you sweat, and sometimes you pass urine, and then it's done.
So some work, some not.
Some work, some not.
Okay.
And also the one that is taking it, because it's like when we do exercise, because even exercise does so.
Okay.
So when you do exercise, basically you can see that most of the people that do exercise, after doing exercise, they come back, and when they come back to relax and they begin again to eat.
Okay. It's just replacing what you.
And then they replace, So what they have burnt, it is basically, so I mean, it's a waste of time.
By the way, there are even these other products where they it's just like a tag. It has like something. It's just a paper. They put it on the belly.
Yes.
That it's also a detoxing solution to help burn the stomach fat.
That one I can't go into it because I don't have knowledge about it, you know.
Okay.
Yeah, most of the time, some things we need to research about it. But I'm someone who doesn't just be taken by anything.
Okay.
I got to do some research on it and then, yeah.
And we have seen many cases where people are being harmed by this. What's your take on that?
Yeah, it is because they don't take precautions. I mean, everything, every medicine, even conventional medicine has been killing people. Actually, most of the medicines that are killing people more are the on-counter prescriptions.
Oh,
the people are dying. You just go and do the research and you will see. People prescribe for themselves. They come on counter. I mean, give me this, give me that.
Okay.
They're dangerous. I mean, when you're taking something, you have to know its substance, and then you also need the contraindications of it.
Okay.
Yeah, you can't just take a medication without even knowing the contraindications in it. Some of it, you know, they tell us. I mean, if you're pregnant, don't use it. If you're suffering from such and such a disease, don't use it. Yeah.
So, Doctor, we are still continuing,
Yes.
but to our dear viewers and listeners, have you ever tried any detoxing solution or any herbal cleansing solution? What's your experience? Or do you have any question about this? Send in a message or call in on the number they are going to present on your screen, and then we shall discuss them. We have Dr. Kunoba with us here in studio, so please make sure you send in your message because he's going to be answering all your questions. Okay, doctor, as we move further, is there any possibility of like overdose in these detoxing situations? And also, can they damage our bodies?
Yes.
Okay.
Because, you know, most of the time, people don't understand these things. There are certain issues that we normally need to think about.
Okay.
When you do detox, it may erase all the minerals that are inside the system. And someone may collapse.
Yeah.
That's why we are always encouraging people that whenever you are taking substances from people, you should know whether they are professionals in it.
Okay.
You know, I've been listening to the news when you're reading here and talking about this. When we talk about bringing in herbs also into the fraternity of health.
Yes.
This one also it shows that even herbs have got doses.
Yes, of course. Yes.
You shouldn't be played around. I mean, even herbs have got doses, but because people that are handling it, they are not educated in it.
And for the law they have put, I don't know how people are going to, the people making these products are going to handle, because for the law that has been signed on by Museveni, it says that they are going to put high restrictions on the people doing these solutions without them being licensed.
That's why you see that the National Drug Authority is helping in certifying the products.
Okay.
You know where they come from, how are they handled, to the up to the end user.
Okay.
How does it reach to someone who is going to use it? Was it prepared properly there?
Okay.
That's why it's taken to the analytical laboratory to be checked.
Yes.
To see the microbes there. You may have your herbs when they are already contaminated.
Of course, and you're selling it to people. Do you think social media is part of misleading the people about detox and also cleansing?
Definitely, yes, because it is marketing. I mean, people are marketing their products and they have no control. Day by day, and there is no control on it.
Yes.
So.
Okay, so doctor, as we are winding up, and what is the safest way for someone out there to detox and also support their body's natural system?
What I see that many of them should consult people that are having knowledge about it before they do it.
Okay.
Yeah. If you know people can just direct you, go and do this and that.
Yes.
That one may be a little bit dangerous.
Okay.
And most of the time also we also have to be careful. Most of the time when you sit here on a TV and you tell people about any substance, they can just go straight to the bush and look for it and come and use it.
come out and they use it.
Yeah.
Well, you know, our local people, they know, they all, as I told you, for me, I've taken that, the other.
Which is under thing.
Oh my God, I've taken it a lot. Okay, so doctor,
Yes.
also what role does diet play in keeping the body clean?
Yeah, as I've told you, that most of the time the foods that we eat, you need to think about foods. You know, here, there is a saying also, when we were growing, they used to say that when you take chicken, it stays in the stomach for 7 days.
Okay.
They are basically, people even brag about it. I'm eating 7 days. I mean, 7 days. I mean, this is food that is going to stay there for a long time. The more food stays in your belly for long, then it will cause problems.
Yeah, sure.
You need to follow the sequence of the colony transit.
Okay.
What time does the food need to stay there? That's why we see that even when we are taking foods, we are advised not to mix it, many
yes.
kinds of foods, because there are some that we eat and they take long to get out, and others take a short time to ferment.
Yes.
So whenever we eat a mix of foods, some of it, when it gets inside us and it ferments, it causes a havoc in the system.
Okay.
That's why last time I told you that you become a brewer.
Yes.
Because where is fermentation, there is alcohol.
Okay, so doctor, also how important is water intake in detoxification?
That is the best way of it, because the more, even like all our organs, they need water.
Yeah.
Yeah, they need water. That's why I told you that when we check in our machines, we can as well show you the water content and the level of water that you have in your system. Such we can advise you that if you're not taking enough water, please go and take enough water. Okay. That one also depends on your size.
Okay.
On your size and weight. So it depends the amount of water that you're supposed to be having in your body.
Okay.
But water taking is one of the best way of cleansing our bodies.
Okay, so doctor, what are some of the warning signs that show that the detox method you're using is harming you?
You should go to first how you can detect and know that your body needs detoxification.
Okay.
And that is foremost, if you're having stomach aching,
Okay.
that is a sign. When you're having headaches, that's a sign. When you're having pains in the, you know, in those places near the neck and whatever. When you feel fatigued, you're feeling tiredness, you feel the heaviness in the head.
Yes.
All these are the signs that are warning you that you need to detoxify.
Okay, so doctor, also who should completely, as you're going to, I think you're going to sum up all of it together, who should completely avoid the detox?
Some weak people.
Okay.
Talk about people that are sickler.
Yes.
When you know you have sickle cell, you're weak.
Yes. Yes.
Your body is very weak. So you don't need to go into such things.
Yes.
Because you know, you dehydrate quickly.
Yes.
And anybody that is having any kind of disease that is weakening the body,
Okay.
well, we shouldn't go much into that unless you know there is a profession that is going to help, because most of the time when we detoxifying, we also give a lot of water,
Okay.
so that we can replace the water that is getting out.
Yeah, sure.
The same applies to even our children. If they are diureting, what we do is just to keep on giving them a lot of water so that they don't get dehydrated.
Okay, so doctor, as we are winding up, give us your last take on detox and herbal cleansing solutions, and also there, for the person who did receive your number the last time, I think you should repeat it. Also send greetings to the people that are watching you today.
Okay. One, what we should know is most of the time we need a detoxification,
Okay.
but with precaution.
Okay, yes.
Don't just rush, because it may cause harm to your health.
Yes.
Yes. You know, you may think that you are helping yourself, whereas it's instead of you know, we have a word that is called health reform. It become a health deform.
Yeah, of course.
So,
just like that.
yeah, you can kill yourself. So with that one, people should do at least approach professionals,
Okay.
people who know what they're doing. Those are the people that I can at least help them
Okay.
get the treatment that is proper for their health.
Okay.
Yeah. So with that one, I want to actually appreciate for people that are viewing us everywhere they are. We appreciate it, and we think that whenever you come on this program, actually, I didn't actually remind you about writing down and because this is what can help you. And you know, my teacher told me not to rely on my memory.
Of course.
So the best is at least jot down, write something. It will help you in the future. Yeah, because many people are messing around. My number for people that would like to have my services.
Yes.
It is 0756 40 13 73. That one is on WhatsApp.
Okay.
So that one you can send a message, or you can even people that we are handling with cases. This is the number that they use to send in their diagnosis reports, because we don't want to handle cases without checkups.
Of course, yes.
Yeah. We are not guessing. We don't want to guess.
Yes.
Yeah. The another number is 0772 40 13 73. Yeah, that one you can call at any time. Yeah, we will get you.
Okay.
Now I know I have friends that have been watching this program. Like basically, I first talk about people at home. Huh?
Yes. Wife.
I know Mama is not there. She has gone also in another meeting somewhere at Makerere.
She has missed the show.
She has missed the show. But you know, these days at home we don't have children.
Oh, it's only you.
It's the no. We have the grandchildren.
Okay, the grandchildren.
Yeah, but I told them you have to tune in. You get it, no? You have to tune in, and so Jaja Jaja presenting it. I want to greet my Musanji. Musanji, you know, is my elder brother where we marry.
Okay.
Musanji, Mr. Kaluji at Chaviri. Greetings to you. May you greet all the people around there. I also want to greet my family of the medical missionaries, whoever that has been watching, medical missionary movement. Yeah, this is the way to go. Let's go and help the nation. And also my church where I come from, and that's Kawempe Tula. If they've been watching, I greet you all in the name of the Lord Jesus Christ.
Amen.
Yes.
Thank you very much, Doctor. To our dear viewers, we've seen that detox is not just about what you remove from your body, but how you take it daily. Before taking and following the trends, take time to understand what your body truly needs. And this is TV1, of course. We tell you to we make you see the difference. And stay tuned for more and more updates coming up. And stay safe. And thank you for tuning in. Let's meet again next week at 4 exactly, from Monday to Friday.